Good morning, everyone, and welcome to Allied Health 102, Introduction to Phlebotomy. Now, as we all know, this is typically a class that meets every Tuesday and Thursday from 9:30 to 10:45 in person. But we do have events that occur, whether it's bad weather or, God forbid, a pandemic, where we have to transition certain aspects of the class online just to avoid us getting too far behind on the information we need to know prior to us being able to meet again in person. Now, I want to go over this and just realize I would like you to make sure you go over this presentation and anything that I let you know during this presentation that I would like you to do. Please try to get that done before we meet again in person, whether that meeting would occur on a Tuesday or a Thursday. Please make sure this gets done prior to us meeting again in person. Now, as you see on screen, it says supplies, because if we were in person, especially on the first day, I would have had your copy of your syllabus for you, which can be found embedded in your Canvas course under the Simple Syllabus tab, which is really much better than the paper handout I give you, because all the links on the syllabus for really good things that will help you is embedded in that electronic form, and you can easily click on those links and go straight to things like the handbook or the absentee policy for BIPSI or whatever you need to do. So make sure that I understand that this is an in-person class, but guys, there is a lot of useful information on both your lab and lecture Canvas course. So make sure you get on there and go through it. Also, all your grades, both for lab and lecture, so I want you to hear this, and I will say this again when I see you guys in class, all your grades for both lab and lecture will be housed inside your Canvas course for Allied Health 102, which is your lecture. There are Canvas courses, though, for both your lab and lecture. The Simple Syllabus is on both. Both your syllabuses are on those Canvas courses, and you will also be able to find your tentative course calendars for both lab and lecture, which when we meet in person, I will go over in detail when I give you the handout, and I will go over some of the syllabus with you today. So what do you get? What will you also receive in class? In lab, well, let's talk about lecture first. You will get a white, sometimes you will see it referred to as a black binder, because some students like to switch their lecture binder from the binder that I give you, which is white, which has your study guides in it, into a black binder, so they have the white binder for lab and the black binder for lecture. You do not have to do that, okay? But when I see you in class, I will hand out a small white binder to you that has all of your study guides in it, okay? And not on the first day, because the red backpack is supplies that you will use when you are sticking for real in lab class. And we don't stick for real in lab class until after you have gone through sticking the arm and you are proficient at that, and you take a venipuncture skills test on that practice arm. Once you pass that venipuncture skills test on the practice arm, then we will move to sticking each other for real. At that point, you will need the supplies in your red backpack. So you may not get that red backpack for the first week of class, but you will get that. And you will bring your binders, whether it's your lab binder or your lecture binder, and your red backpack to every class you come to on Tuesdays and Thursdays. Never leave those supplies at home. Never leave those binders at home. Now, my name is Melissa Shepard. I am the assistant professor. Also, I am the phlebotomy program director. We're going to go over your bonus point options for you. I'm going to give you plenty of opportunities to get bonus points. One of those bonus points will be for you to write up a one paragraph little type it up. I'm sorry, don't write it, type it. type up a little 1-paragraph synopsis about yourself. Because, guys, I love what I do. I love to teach. I'm going to tell you now that my main objective is to make you the best phlebotomist I can, so that when you go to hospital clinicals, you are so impressive to the people at those clinical sites, such as Willis Knighton and Ochsner's, that they want to hire you. I want to get you the best job I can with the best pay and the best benefits. And then I'm hoping that you continue your education further at BIPSI. So I have an MPH, which is a Master's in Public Health, and I am a medical laboratory technologist, and I am an ASCP certified medical laboratory technologist, and I worked for 15 years in both a hospital and clinical settings as a lab tech. I love to teach, and I want to get to know you, and I want us to build a rapport and a relationship so that we can both help each other get through this semester and get you where you want to be. Now, I do take roll. I do attendance at every class. Class begins on time. For lecture, that's 9:45. I ask that you guys be prompt and do not miss class. Because remember, this isn't just a class. It will be your career, your profession. Now, we all have responsibilities. We all have things that can go wrong. Preparation is key. Make sure you make arrangements not to miss class. Now, how do you do that? Make sure you have someone that you can depend on to help you with your kids if you have kids. We understand that kids become ill. We understand that schools closes due to bad weather. Please make sure that you have a backup so someone can help you with your children so that you don't have to miss class. Make sure you arrange some kind of backup transportation for yourself in case you wake up one morning and you have a flat or your car won't start. Make sure that you schedule your doctor's appointments, any appointments that you have outside your lecture and lab time. I am not going to make my dentist or doctor's appointments or any appointments for myself during the time that I'm supposed to be in class with you. Why? Because I have a commitment to be at work on every day that I need to be there so that I can make sure that I prep you for the career and profession you are going on to. That's not my only commitment to you. My other commitment to you is make myself available to you, not just during my office hours, and we will discuss that at length, and to give you the study guides you need for your tests. My tests come directly from the study guides, because I don't want you to guess at what you need to know, to be a competent and professional phlebotomist. I want you to know what you need. Now, when we meet in person, I will give you your phlebotomy workbook, and I will go over the syllabus with you, and I'll touch base on the syllabus today. We're going to go over today what your assignments are, and I will touch base with them when we're actually in lab and together, and we can go over all this stuff. The workbook is a little intimidating when you first see it. However, we're going to go over it page by page, and then that way you know. And then, guys, I'm going to be honest with you. If you take that workbook home and you never take it out of your backpack and you never open it and you never get familiar with it and you never go through it so that you can know what's in it, where's it at, and all that, you're going to be in trouble, okay? You're going to have to put in the work at home. I can give you the study guides. My tests can come directly from the study guides. I can give you all the appendixes and study material and online Canvas course videos and everything. But if you don't do the work at home, it's going to be hard for you to make a good grade. Now, when we go over the phlebotomy workbook in class and the syllabus, you'll know what your assignments are and when they're due, okay? The workbook chapters, which are the chapters that you're going to be responsible for reading, and then there's study guides at the end of those chapters. The lab chapters are not very long. We'll go over those. I'll show you where they are. They're at the front of the workbook. Guys, you're going to hear me say this to you a lot. The sooner you read those chapters at the front, and the sooner you fill in those study guide blanks and start studying the study guides, the better prepared you are going to be for your first test. Now, your first test in lab will be on chapters 1 and 2 that will be in the front of your workbook that I will give you, and also Appendix A. Appendix A is located in your white lab binder, and on that, it's going to be broken up into tests. So the first test, and it's going to be at the front. Guys, it is so easy. You just have to put in the time. The top of Appendix A is going to say test number 1. There are going to be 10 tests that you have to learn for that first lab test. It's going to tell you the name of the test. Let's just say electrolyte profile. That's the name of the test. It's going to tell you the tube colors that you can draw that test in. So let's say for electrolyte profile, it's red, green, or SST. It's going to tell you what section of the lab you take that test to, which in this case would be chemistry, and it's going to tell you any special handling that you need to be aware of with dealing with this specific test, such as making sure that that specimen is non-hemolyzed. You will need to memorize all that stuff. Memorization is just a part of learning. It is a way you can lock this knowledge into your mind and then use that knowledge to work through scenarios that you might face when you're out there working as a phlebotomist. That brings us to Appendix B, which is your case studies. Now, there's 10 case studies, and to pass this course, you have to pass 5 of the 10 case studies with a 70% or better. Now, let me just bring this to you. You're not going to start doing those case studies on day 1, because what we've got to do is build that foundation of knowledge in both lab and lecture that you will then use to be able to critically think through these case studies and figure out, if you're out there working in the real world as a phlebotomist and you face this scenario with a patient, what is the best decision you can make to take care of your patient? That is what the case studies are for. And we'll go over, and they're going to be listed on the tentative course calendar, and you will have all the knowledge you need to be able to do those case studies when the time comes. Appendix C is your consent forms. We're going to talk about those, and when I hand this book out to you, when we're workbook in class, you will read these consent forms, sign the consent forms, date them, and you will turn them back into me. Also under Appendix C is your worksheets. Now, the worksheets are the worksheets that you're going to be using in lab when we're doing the hands-on stuff that teaches you the actual hands-on things that you need to do when you're out there working as a phlebotomist. Guys, this lab is so important. You do not need to miss lab. This is literally when you learn to do the things that you will do as a phlebotomist. And again, my job is to make sure that you are the best professional phlebotomist you can be, so that you impress those clinical sites so they want to hire you. Which, remember, if you're wanting to continue your education and become a medical technologist, if you're wanting to become a practical nurse, a nurse, all the knowledge you learn, everybody in healthcare needs to be able to find a vein. And whether it's being a nurse and starting an IV, or whether you're injecting dye into someone, whatever it may be, learning to use needles and find veins is a useful task no matter where you go to in your career. Learning it now will make you a better healthcare professional. Now, when we're filling out these worksheet pages, and I will go over this with you multiple times, we only use a black ballpoint pen. And you will see when you go on your Canvas course that one of your supplies on your supply list is to have a black ballpoint pen. Guys, we don't want gel pens that smear, okay? And it needs to be black. We fill out all lab forms with a black ballpoint pen. All your blanks on these forms must have a check box in them. And remember, if you make a mistake, we don't scratch out, we don't white out. These are admissible in court. These are laboratory documents, and we need to learn now how to appropriately fill out lab documents. You put one line through whatever your mistake is, your initials out beside it, and then what it should have been. So if you wrote down 120 and it should have been 140, then you put one line through 120, your initials as the person who made the mistake, and then 140 out beside that. We will go over the consent forms. You will have to sign and date your venipuncture safety form. You will perform venipuncture. I will be by your side during the entire procedure, but there are complications dealing with venipuncture, such as hematomas, the ability to damage an artery, a nerve, or a tendon, and syncope, which is when you feel as though you may faint. We're going to go over that in lab class. You're going to read through your venipuncture safety form, and then you're going to sign and date it and turn it into me. Because remember, you will not stick a real person until you become proficient at sticking the arm, and you will never stick anyone in lab without me standing right next to you. Then you will sign and date the informed consent. Okay? You agree to allow us to perform venipuncture on you, and you need to know that it involves some minor pain, but it helps you develop empathy for your patients. I do not want the first time you ever stick a needle in a patient's arm to be when you walk in the hospital, okay? And then you will sign and date your confidentiality agreement, because remember, you will not disclose confidential information, reveal financial information, use patients' names when on the phone, leave test results on answering machines, on their cell phone voicemail or any voicemail, or leave charts where they can be seen by anyone else. We will go over the safety guidelines in the lab, including cleaning your work area, restocking your tray, being able to understand where your fire alarms, extinguishers are, know your evacuation routes. If you have any medical conditions such as HIV or hepatitis B or C, letting me know about it. That we do not eat, drink, apply makeup, or remove your contacts in our lab class. And we will go over where you store all your belongings to keep our work area safe. We also talk about at the end of each and every day, you will put your tray and your equipment exactly back where it belongs, clean your work area with 10% bleach, and remove your gloves and your lab coat before leaving the lab. And we will go over the difference between your cloth lab coat that you wear to meetings and when you're outside the lab, and the impermeable paper style gown or lab coat that you wear that protects you from blood and body fluids when you're performing venipuncture or doing any type of CLIA wave testing in the lab. And then we will talk about social media and how we don't friend our teachers or patients or employees of any of the clinical sites. We don't take pictures or post anything on any social media dealing with our clinical sites. And we'll go over that in depth. You'll read over that social media agreement, and then you will sign and date it. Guys, these are some slides you will see when we're in lab. The blue area is what we're going to be doing right now, okay? And as soon as we meet and you guys get your chapters, which I'm going to go ahead and tell you now, they are also available to you on your Canvas course. And I would like you, if possible, to go ahead and open up chapters 1 and 2. You don't have to print them out. You can open them up on your Canvas course, and you can start reading through chapters 1 and 2, okay? When we're in lab and you have it, we're going to go over that so you know exactly where everything's at. We'll go to the back where the worksheet packets are. You're going to take out all those forms that we just talked about. You're going to take those home with you, read them, sign them, date them, and then you'll bring them back during the next class and turn them in. And then you will take that worksheet packet that's going to be for chapters 1 and 2, and then it will then be housed in the front pocket of your white lab binder. So each and every day you come in, you can easily get to it, and we can get our day started. Guys, we never have enough time to get everything done that we would like to do. Remember, time management is so important, and being organized helps you be able to manage your time and get all this stuff done. When we get together, we're going to talk about homework, which is going to be worksheet 1A and 1B, laboratory basics on professionalism. You'll read about professionalism, which is on page 7 of your worksheet pages in chapters 1 and 2. You're going to read through professionalism, and then you will have a little worksheet that you have to complete based on that reading of that professionalism. Guys, it's important to read I have detailed directions on these worksheets. If you read the directions carefully, take your time, read the directions carefully, then you will ace these worksheets. People who don't do well on the worksheet or don't make a good grade are people who don't take their time, carefully read them, and get them done. If you're trying to do this stuff in a hurry at the last minute, then a lot of times that's where you make errors. We will also go over practicing tying the tourniquet. Okay? There is videos on your Canvas course. Okay? And I want you guys to go onto your Canvas course, and the very first, when you say start here and you go down, it says Lab 1, Chapter 1. There are videos under that one about tying the tourniquet, about donning and doffing of your PPE. Please watch all the videos under that lab and lecture day 1 that are on Canvas. Please do that before you come to class, okay? If you have any questions, concerns, you can't locate something, please reach out to me by email, preferably through Canvas, but you can email me, and we're going to go over my contact information, and let me know so I can help you find it, because I want y'all doing this before you come back to class. Now, if you are not going to make it to class, please email me concerning your absence. It is your responsibility to email me and let me know you are not going to come to class. If you do not communicate with me properly, it will be difficult for me to make sure that I take care of you, okay? If you miss class and we don't have a test, I am not going to necessarily make you get a doctor's note. But if you miss a class that you know, and you will know that we are having a test that day, you will have to have a doctor's note to make up that test. It is your responsibility to email me and let me know you're going to be absent. It is your responsibility to email me within 1 week of missing that test and arrange to make that test up prior to midterms during my office hours. You will have my office hours. You will know when they are, and it's your responsibility to schedule a time via email so that I can check my calendar, make sure no one else has that time, put you on the calendar. I will confirm that with you, and then you will show up at my office on that date and time to take your makeup test, and you will need a doctor's note for the test. Now, Chapter 1 in your Big White Lab Binder, which you can also find all of those on your Canvas course. You do not need to print them out, but it would be good if you could go ahead and start reading Chapters 1 and 2. Under Laboratory Basics, which is on page 5, we talk about the chain of infection. One of our biggest responsibilities as healthcare professionals is to break the chain of infection. Now, that chain of infection is the method by which infections spread from one individual to another individual, okay? It consists of the infectious agent, whether that's a bacteria, a fungus, a virus, a parasite, whatever. It's a reservoir. That reservoir can be a person, they have the virus. It can be a place. That virus can be on an object. In a place or a thing like your pen or a countertop where that infection agent is living. Then we need that portal of exit. How does that infectious agent leave that reservoir, whether it's a person, place, or a thing? Then the means of transmission, the ways the infection agent travels from the reservoir, remember that person, place, or thing, to the host, which is now that can be anything. It can get on your lab coat, it can get on a pen, it can get on your unwashed hands, and it goes from that person, from that into the person. Okay, so sorry guys, I had to pause it for just a second, but I was talking about means of transmission, okay, like it can be an unwashed hands, right? And then we're talking about portal of entry. That's a path of infectious agent takes into the body. And in other words, how does it get into you, right? Whether somebody sneezes in a room and then you happen to breathe in the droplets and then now the infection's inside you through your mucous membranes, or whether you have a cut on your skin and it gets in that way. And then last, we have that susceptible host. That is a person who is lacking resistance to the infection. That's why when you see sometimes where, like during COVID, or sometimes you'll see this during the flu, where a whole house full of people and 3 people get the flu, but the other people don't get the flu. It could be because those 3 people, not necessarily even that they're elderly or sick or have some underlying health condition, but because maybe they're worn down. That's why when you're in school, please make sure that you get plenty of sleep, drink plenty of water, make sure you take care of yourself, because if you get too stressed out and you're not getting adequate sleep or eating properly, moving, getting you some exercise, that kinds of things, then what you're doing is you're causing your resistance to go down, and then that can leave you open to infections yourself. But what we're talking about here is typically people in hospital settings. Okay. Now, when you're in lab with me, we're going to go over where all the waste is. I'm going to show you where the broken glass box is. We have one in the lab. That's where you put any broken glass that is sharp, but it has no blood or body fluids on it, right? So it's just broken glass that is sharp, but it has no blood or body fluids on it. That goes in the broken glass box. Then, of course, we're going to have regular trash cans throughout the classroom. What's that for? That's for the wrappers on your needles, the wrappers on your Band-Aids, things that can go in the regular trash. They have no blood or body fluids on them. Then we have the biohazard boxes. Those are going to be trash cans. They're metal. They're usually orange or red, and they always have the biohazard symbol on them. This is where you put waste that, listen to me carefully, is not sharp, right? But it does have blood or body fluids on it. If it has blood or body fluids on it and it is not sharp, then it goes in the biohazard boxes. And we will go over the locations throughout the lab for those. And then there's sharps containers throughout the lab. They're on the wall. There will be some smaller ones on your phlebotomy tray at your desk. This is where it has blood or body fluids on it, but it's sharp, like needles or bloody slides or vacutainer tubes with blood in them, okay? Full sharps containers are then sealed up, and I will go over with you guys how to do this, and placed in the biohazard boxes. We will go over safety equipment, okay? There is a donning and doffing video on Canvas. Please watch that prior to coming to class on whenever we meet again, whether that's Tuesday or Thursday. We're going to go over these safety equipment. These are equipment used by healthcare workers to keep them safe from hazardous substances. Remember, PPE is personal protective equipment. That is safety equipment that is worn on your body. Things like lab coats, gowns, gloves, face shields, safety glasses, and masks. There are other safety equipment like plexiglass shields and plexiglass hand guards and eye wash stations. These are safety equipment, but they're not PPE because they're not worn on you. We're going to go over in lab the difference between antiseptics, disinfectants, and sterilization. Antiseptics are those milder cleansing agents that are appropriate to be used on skin. They inhibit the growth of microorganisms. Some examples of that would be 70% isopropyl alcohol, soap and water, betadine, iodine. Disinfectants, these are harsher chemical agents. They are not to be used on you, and you should not be handling them without the appropriate PPE. These are disinfectants that's used to kill germs and microorganisms on surfaces such as your laboratory counter or your drawing station. Some examples would be a 1 to 10% dilution of bleach, formaldehyde, and other things like that. Now, the only way to kill all microorganisms is through sterilization. I'm sure you guys may have heard of autoclaves. Sterilization is the only way to kill all microorganisms. You need to know the difference between chemically clean gloves and sterile gloves. Chemically clean gloves are used for routine venipuncture. You would not use sterile gloves for routine venipuncture. The gloves that you will have in your lab, and they'll be located all over the lab, are chemically clean gloves, and we will go over that in lab. I will show you an example of sterile gloves. These are sometimes used in newborn nurseries or patients in the ICU or patients who are in isolation. Sterile gloves usually come packed individually with just 2 sets of gloves in a package, and they are labeled as sterile. But we do not use them for routine venipuncture. Professionalism. Well, remember we talked about on page 7 of chapter 1 that we want you to read about professionalism. Remember, professionalism is just a set of rules that govern all healthcare professionals, whether you're a med tech, a phlebotomist, a pathologist, a nurse, whatever. Make sure that you, if you can, that chapter 1 is located on your Canvas course. Try to read through chapters 1 and 2 between now and when we come to class. I will hand out your big white lab binder, and your homework will be in there for you to fill out. You don't have to worry about that now, but it would be really good if you would read both those chapters online before you come to class. What are some characteristics of a professional? Professionals dress conservatively. I had a professor one time tell me there's a time and a place for everything, and this is not the time or place. Guys, I know you know about this because the clothes you wear out for the evening with your friends somewhere is not the same clothing that you would wear to church, right? So when you go to work, you want to dress conservatively. I just had a meeting with Willis Knighton Health Systems the other day, and they talked about no multiple piercings. If you have multiple piercings in your ear, that is fine. However, when you go to clinicals, you will have to remove them. They only want one piercing. If you have tattoos, you will have to cover them up. Guys, I don't make the rules. I just play by them. Okay? And again, my job is to get you the best paying job with the best benefits. You will have to cover up your tattoos. Okay? No odd hair color or weird haircuts. They don't want that. Okay? So when you get ready to go to clinicals, if you had pink or blue hair, which, hey, that's pretty. However, if you have that hair color prior to going to clinicals, you will need to switch back to a normal hair color prior to going to clinicals. Your club, and I hate to say things like this, but we've had issues, usually not with our school, but with other schools, and they talked about that in the Willis Knighton meeting. Your scrubs need to be clean. They need to be unwrinkled. You do not need to look like you slept in them. You need to have a unwrinkled white cloth lab coat. You can wear jewelry, but it needs to be limited. You don't want big hoop earrings, okay? Your makeup needs to be minimal. Your hair needs to be pulled back at your neck if it is long. Why? Because you don't want your hair hanging down onto the patients. It could get into blood or body fluids. If you're a man, they prefer you to be clean shaven. Cleanliness is vital, y'all. They need you to be bathed. They need you to wash your hair regularly, wear deodorant. Nails must be short with no fingernail polish or nail extensions that can harbor bacteria. And we'll go more into those nails. Long fingernails have no place in healthcare. They don't. And if you do it anyway, after I showed you how those long nails harbor bacteria and the problems they have caused, including deaths of infants, I would hope that you would want to stop that. Now, displays professional mannerisms. You want to be compassionate. You want to be gentle, pleasant, and considerate. Guys, these people are sick. They are at some of the lowest points in their lives. We want to show them compassion. We don't need anybody in healthcare that is only there for the money. We need you to be honest and fair. You are trying to get these patients taken care of as quickly as humanly possible without acting like you're in a hurry. That's an art and a science that I will teach you. You have to always observe confidentiality. Now, once we come to class and I pass out your book, hopefully you've already read chapters 1 and 2 because they are available to you on Canvas. You will take that sheet home with you for homework and you will fill it in. You will fill in your name and date on the front of your workbook packet, and directions for all workbook packets are detailed and listed on there. Remember, you must have and use a black ballpoint pen on all your lab worksheets. All blanks must have a check in them or an X in them. You must, if any mistakes are made, one line through it, your initials, and write your correct response out next to it. You will also have worksheet 1B, which is going to be tourniquet tying homework. Again, there are videos on Canvas showing you not only the donning and doffing of PPE and other things, but also tourniquet tying. I will demonstrate that tourniquet tying. We will practice together in lab when I see you, and then you will take that worksheet 1B home with you, and you will practice tying that tourniquet. It is the start, guys. Tying the tourniquet is the start, and then you will complete your worksheet with a black ballpoint pen, making sure all check boxes have been checked. Now, here are the supplies you need, and you need to have them within 1 week of class, okay? You need some Scantrons. They're the green ones that are half a sheet. They're available in our bookstore in Building F where the subway is on campus, or you can order them online. Do not wrinkle them or bend them, okay? They need to stay flat, nice and neat. You need a pencil or two. You need 1 to 2 black ballpoint pens. It helps to have highlighters to help you study. However, I don't make that a necessity any longer, but I really do believe in highlighting things to help you know the pertinent information. You will, however, need 2 permanent markers like Sharpies. If you write big, you're going to need this little tip Sharpie. If I were you, I would get a fat tip permanent marker Sharpie black and a thin tipped Sharpie. Okay, you need both. You will need a white lab coat. You can find those at Scrubs Unlimited. They may sell them at Walmart. There's other places in town that sell them. It's going to be the short, like a little jacket, not the long white coat, because that's what doctors wear. The short white lab coat, okay? And you will need those dark burgundy scrubs. They look like the Bipsy maroon color. You will need closed-toed shoes. You can wear Crocs as long as they don't have the holes in them that would allow blood and body fluids to go through that hole and get to your feet. They have to have a heel on them, so they can't be open like flip-flops in the back. They need to be either vinyl or leather. They cannot be cloth. They can either be white or black, but if you wear white, you need to have matching white socks, and if you wear black, you need to have matching black socks. You need hand sanitizer, just one of those small hand sanitizers, and you needed to bring it to class every day. And you no longer need the black 1-inch binder for lecture. We will give you a 1-inch white binder, but if you want to keep them separate by color, you're welcome to do that. And I'm going to go over this, but you will need some Post-it tabs for both lab and lecture because I want your binders to be organized and tabbed. And we're going to go over this. You will get a grade for that. Remember, these are some examples of proper shoes for lab. Shoes must be black or white, closed-toed, closed-heeled, and must not have any material on them. Examples of the shoes that would work. You see there is down at the bottom. You see the Croc down at the bottom. The Croc down at the bottom in the middle has that heel on the back of it, and there's no holes in the top, okay? And it's plastic or leather or vinyl. Then there is black and white leather shoes or vinyl shoes. I do not need you to spend a lot of money for it. However, I will say this, you will be on your feet a lot, so take that into consideration. Guys, that's the end of this particular video for lab. Please check your Canvas course for lab. Please look at all the videos that are on there. Please look at all the pictures that are on there. Please go over chapters 1 and 2 if you can. You do not have to print them out. You can open them up on and read them on the Canvas course on your computer. If you run into any issues, please reach out to me through Canvas or through my email. And my email is mshepard@bpcc.edu. Now, that is also listed on Simple Syllabus. You can click on that tab, and my office hours are listed on there, my office number, which obviously if we're doing this, I'm not in the office today, but my email is listed on there too. And I spell Shepherd, SHEPHERD. mshepard@bpcc.edu. That's my email address. Please email me with any questions, comments, are concerned. Have a wonderful day, and I'll see you in class.